When I'm talking about the Doneen method and utilizing the latest, greatest science, uh, they don't just jump knee-jerk reaction. They evaluate those studies, make sure they were properly done, because there's better techniques to doing studies. Some are not foolproof. They rely on the foolproof studies that have been done and that take into account a lot of different factors and before they come to a conclusion to say this is a way that we should go with this method. And it's been the great thing is the evidence in their methods have shown significant improvement in the lives of their patients. They have a deal with their patients where if that patient has a heart attack or a stroke, then they refund their money for the year of all the tests and treatments that they've done. And over this extensive time that they've been doing their method, which is about 15 years, they've had only one person have a heart attack and had to refund their money, and that was it. And that was a patient that was not compliant with the method. So using, they've looked at the studies that when we're talking about these scientific studies, or they've done these tests on volumes of patients, whereas in my clinic, I'll have a patient and it's more of a subjective, although I do have objective data as I follow them of their lipid status, their INTs, and see them improving. But they've done these studies over years' time to see all the effects, are there adverse effects to the medications being used? What is the significance of the amount of improvement in the patient's well-being? So those studies are very important. They're important to every decision that we make in medicine. Medicine is based on science and has been since its beginning. Everything is an experiment. It's just these are more elaborate experiments and studies, and they've I feel they don't jump with the trend and always go to the next best thing. It needs to be proven, and it needs to be from a very well done study.